So the first mosquito tested positive for the West Nile virus here in Connecticut, which is a little bit early. So we're catching up with Dr. Alina Filozov, who is an infectious disease specialist, to just talk a little bit more about West Nile. So who is most at risk?
West Nile virus, when it is infecting people, can cause anywhere from a very mild or even asymptomatic illness, which means that you may not have any symptoms whatsoever, to a very small percentage of patients developing really severe complications as a result. And those complications, the most feared, are related to inflammation of the brain, like meningitis, or inflammation of the brain, even worse than meningitis, causing encephalitis. So those patients who have the most severe variation of the West Nile virus infection may have changes in their consciousness, like confusion, inability, no ability to speak, very high fevers, stiffness of the neck, severe headache. They may have muscle aches. Mild symptoms may include just feeling fatigue, maybe a little achy, maybe kind of under the weather. Sometimes people may develop a rash. Most patients don't even know they have West Nile virus. And of course, when symptoms becomes more severe and unsafe to manage at home or unsafe to manage by an outpatient doctor, you will be referred to the emergency room. Young children, elderly, and patients with poor immune system will have a higher risk of being very sick.
Okay. And what do you do if you don't feel well?
If you don't feel well, depending on your severity of symptoms, if you have just mild symptoms, check in with your primary care. Make sure you report to him or her if you've had recent bites from mosquitoes in which area you were in. But if symptoms are as severe as I mentioned earlier, severe headache, very high fevers, neck stiffness, confusion, or other issues related to communication, do not delay. Please come to the Middlesex emergency room for evaluation.
Most people won't get really sick. We don't have to freak out. But if we can prevent getting bitten, we should.
Absolutely. So insect repellent is your first protection. There are multiple options over the counter. You can buy, they come in a spray form, in a cream form, in a wipe form. And by the way, if you do want to have the most reliable coverage, use a cream or a wipe rather than a spray. Anything that is 30% strength and above is the greatest coverage for you and will protect not just mosquito bites, but also tick bites, which is an added benefit in our area.
All right, all good advice. Thank you so much for your expertise. We really appreciate it.
Thank you very much.
All right, stay safe, everyone. Take care.